Good patients. STDs in the emergency room. What they gonna do? What they gonna do in the emergency room for the STD? So, all STDs are not treated the same. It blows my mind. It blows my mind. It blows my mind, my mind.
911, what's your emergency?
Because when you call your doctor, they just gonna tell you to come to the ER anyway. What the ER gonna do, child? What we gonna do? How patients think you could have gonorrhea or chlamydia, but you can't have HIV or syphilis or HSV. Like, I don't understand that. I think I understand it. I mean, denial. It's called denial, But there are many emergency rooms, y'all, that do not do full STD testing. Thinking that you can, I hate, the word using is not the best. Y'all, I don't mean using like taking advantage. That's not what I mean. So maybe I'll say going to the emergency room for STD treatment. Specifically, you're saying you want to get tested for STDs, but I ain't got HIV. Like, I might got gonorrhea, but I ain't got HIV. No, it's transmitted the same way through sexual intercourse. The same person that gave you gonorrhea could have gave you HIV. Like, but you're in denial, and so what ends up happening is like what happened in 2024. Like, that's what I say. I don't know what generation is it? Gen Z, Gen X, Gen STD, what? Because the STDs, like, it's just rampant, right? Well, I mean, it was a newsflash, like, summer 2024, where it was in Texas, like, it was like so many people who had, STDs and got treated for STDs. And how do they know? Because it's reportable. Those things are reportable. Okay. But I never understand, and I always educated patients that just do not think that you leaving here with a clean bill of health because you got a shot in some pills. It was only for gonorrhea or chlamydia or trichomonas. That's it. Or you might have got a shot for syphilis if you came in, because there were some patients that would have an outside test done and they could bring in the result. So you brought in the result of saying maybe you have syphilis, and that emergency room will go ahead and treat you, okay, because you brought in the report. Most emergency rooms will not test for HIV, will not test for syphilis, because they're sending out tests, and meaning you won't necessarily know immediately. In emergency room, we work in immediacy. We need to know now what we need to treat now, not what you can be treated for next week. Okay, that's the difference. So a lot of those tests may not come back the same day. They may come back the next day, or they may take 2 to 3 days. Well, that ER doctor isn't there, and then that puts more burden on the staff. When the staff already has to look up urine cultures, blood cultures, and follow back up with those. So that's why a lot of emergency rooms do not do a full STD testing, and that's the biggest thing you could think, that just because you're coming into the emergency room and you're asking for STD testing, and maybe they draw some blood or they test some urine, and that you're all free and clear because you also chose to get treatment that same time. Biggest thing is when you leave there, you don't follow up and you don't get the full STD testing to make sure that you don't need treatment for HIV or syphilis or any of the other STDs. I got a little more time in this video. So, urine testing for STDs. For male patients, it can be okay. It can be what we call sensitive specific. We're talking only gonorrhea, chlamydia. For female patients, your urine comes out a different hole, orifice, what we call it, but hole in a sense, than your vaginal. I personally don't recommend fully relying on urine testing for women for gonorrhea, chlamydia. There can be some false negatives. Okay, so it is best to open up your legs, get in, go inside, and have a full examination, direct examination, direct culturing of the endocervix and the vagina than just sitting off urine. Because I have seen where the urine may show some general bacteria, but the specifics of gonorrhea chlamydia may be missed because it's coming from the urethra, which is different than the vagina. Okay, anatomy. So but because it's easier to do and it's quicker to do, all right, some hospitals, some emergency rooms are doing a lot more of the urine test. And I just want to, make sure you are aware that if you get a negative, if you're a female and you get a negative urine test for gonorrhea and chlamydia, double check your exposure, double check your symptoms, because it may be a false negative. And it may still be that you have an STD and you need to get treatment for it. The other thing I want to share is that sometimes patients don't sometimes patients don't want to get treated that day. Okay, and so a lot of times you'll be given an option. You're here in the emergency room today. We can go ahead and treat you today since you're here, or we can get you the report and you can come back, or if we can let you know if it's negative or positive. Okay, so sometimes since you're already in the emergency room, we'll go ahead and say, okay, you know what, we'll go ahead and treat you. You're here, let's go ahead and treat you. Or there's some people that decide, you know what, I want to wait for the report, and then if the report comes back positive, then I'll go ahead and be treated then. Okay, so those are some of the options that you will be given if you want to be treated that day, or if you want to wait for the report. I usually tell people, if you got symptoms, go ahead and get treated. You in the emergency room, go ahead and get treated today. Don't be waiting. Just go ahead and get treated. Okay?
911, what's your emergency?